Welcome to Concept in Medicine. In today's tutorial, we are going to be looking at components of kangaroo mother care. But before we do that, let's give an answer to the previous question that was asked. And that was, what is the antidote for beta blocker intoxication? I believe we've all gotten the answer right, and we've written that in the commentary section. The answer to that question is glucagon. Congratulations to all of you. Now, before we talk about the components of kangaroo mother care, let's give a preview to what kangaroo mother care is. So we should know that the kangaroo mother care was first introduced by Dr. Ray Edgar and Hector Martinez in Colombia. And these came about with the consideration of how marsupials handle their newborn. An example is the kangaroo. Then based on that, it was introduced into the world of human beings, where low birth weight babies are treated as such, like the way the kangaroo babies are treated by their kangaroo mother. So when we say kangaroo mother care, it is defined as an early prolonged skin-to-skin contact between a mother or a surrogate and a low weight baby. You should know that it's not always the mother. If the mother is not in good health, then the father occasionally may be the one to do the kangaroo mother care. And when we say low weight, there are categories of low birth weight. We have what we call the low birth weight itself. We have the very low birth weight and the extremely low birth weight. When we say low birth weight, simply we are looking at the birth weight less than 2.5 kilogram. And when we say very low birth weight, we are looking at the birth weight less than 1.5 kilogram. Then extremely low birth weight, we are looking at a birth weight less than 1 kilogram. Now, let's look at the objectives of the KMC. The objective of the KMC is to provide warmth to the baby, safety, also protection against infection, love, stimulation, and in addition, helps the baby to grow, that is gaining weight. Let's move ahead and look at the components of kangaroo mother care. For the components of kangaroo mother care, there are 4 of them. There are 4 components of kangaroo mother care. We can talk about the first one, that is the kangaroo position. The next one, kangaroo nutrition, kangaroo support, and finally, kangaroo discharge. Let's move on and look at them one by one. When we say kangaroo position, simply the baby is placed in between the mother's breast in an upright position with the head turned to one side, slightly extended, with the arms and the hips fleshed. And finally, the baby is secured with a binder. Let's move on and look at the next component of kangaroo mother care, and that is the kangaroo nutrition. For the kangaroo nutrition, we are looking at an exclusive breastfeeding being done whenever possible, and this promotes lactation and enhances breastfeeding. The third component, that is kangaroo support. With that, the KMC health staff provides support to the mother to take care of the baby in the hospital. And in addition to that, the family should also provide support to the mother after discharge from KMC in the hospital. Finally, the kangaroo discharge. With the kangaroo discharge, the mother continues the kangaroo mother care practice at home after discharge from the hospital. Because you should know that always the kangaroo mother care is started in the hospital and continued at home. I believe we've learned something new today. But before we end the session, I have a question for you. The question is, why is it advisable to suction the mouth before the nose during resuscitation of a newborn? Do well to leave your answers in the commentary section. Kindly make sure to subscribe to my channel, like, share, and also comment the next concept you would like to see on my channel. My name is Dr. Del, And this is Concept in Medicine. Bye-bye.